So, what exactly is single payer healthcare? It can mean a lot of things, but here in America, it generally means that the government takes on the role of the healthcare provider, like the health insurance. That means they're not taking on the role of the doctors, but they are determining which services they are covering with this insurance. Each plan has their own allowances on which insurance providers are still allowed to exist and which are like absorbed into the government itself. What changes between all the plans is how they plan to pay for it. Some people increase the income tax. Some people increase how much they're charging companies for medical coverage. Now, with single payer, the system basically gets flipped, right? It's either not single payer or it is single payer. So you're either flipping the whole system at once or you're not doing anything. And that's how they've tried to implement it before. And they kind of just have it sitting there and then they say, never mind, we're not going to do it. That one was in Vermont. They were afraid that the cost would continue to increase and they have to keep raising the income tax. Now, plans here in California have ranged from $340 billion to $400 billion. And that is a total cost. So we already are spending, through all of our government agencies, about $200 billion on healthcare in California. What all of these plans share in common is a pay per service or pay per customer method where you go in for an x-ray, you pay for an x-ray. We are just going to where there are hospital bed shortages, which is an issue across America that has not been brought down to the community level on the actual measuring of it. So we need to figure out where those shortages are, and we need to meet that demand with free public hospitals. And that is the fastest way to make sure that everyone has access to public medical service. What makes this different is this system would pay for salaries, for like rent, and for things like equipment. So it's not paying per visit. If a hospital needs more doctors, then they hire more doctors and they get approved for the salary. They're not getting paid per person that's there. So in this system, if you want to have your private health insurance, you can go ahead and do that. You can go ahead and use the same exact doctors you have. There'll just also be free public hospitals around that you can choose to go to for your doctor, for your primary care, or for your emergency services. Those will just be additional options for you. Now, to pay for free public hospitals, there are a lot of choices. You could do a sin tax, like on things like soda and candy. You could do a travel tax and try to get the people that come visit our state to pay for our healthcare. You could do just an equal percentage out of your income per person. So what do you think is the best tax to use to pay for free public hospitals?